Generically, a hernia is anytime something that should be inside a cavity is poking outside of that cavity. When you're talking to a general surgeon, typically what we're talking about is your abdominal cavity, something that should be on the inside is now protruding outside of your abdominal cavity. So that can be through some spaces that are naturally existing in the abdominal cavity. Things like people hear it described as a hiatal hernia. So that's where things are trying to sneak up through the space where your esophagus comes down into your abdominal cavity to meet your stomach. Or a femoral hernia where things are trying to sneak out through the path that the blood vessels take to get out of your abdominal cavity to go down to your legs. And so there are a variety of other areas. People may typically experience a discussion about hernia like an umbilical hernia or a belly button hernia, or an inguinal hernia down in the groins. Sometimes people have a weak spot that's been created by a previous surgery, something that we would call an incisional hernia. So those are a number of reasons why things that should be on the inside are trying to sneak out. The cause of a hernia can be multifactorial. So sometimes just the way somebody grew, there was kind of a weak spot there. That can present as something maybe like a congenital hernia. Little children sometimes have a belly button hernia where the umbilical cord was attached. It's supposed to kind of seal up after the belly button, after the umbilical cord falls off, but sometimes that stays weak. Sometimes people have failure of the tissues that form the abdominal wall to seal up tightly, something like a diaphragmatic hernia. Sometimes it's a side effect of an incision that a previous surgeon has made, and it just didn't heal up as strong as it normally would have. And then sometimes it can be a combination of those factors, and then also if somebody is doing a lot of heavy lifting, if people are overweight, that's putting more pressure on the abdominal wall. So sometimes things like pregnancy, that can be something that commonly causes women to experience an umbilical hernia. People, if they have a hernia, may experience that as they notice a change in the contour of their belly wall at that area. They notice a bulging. Sometimes that's something that comes and goes in a dynamic fashion. If it's present when they're up and active, maybe it goes away when they relax. Sometimes associated with that, they can feel a sensation of something popping out or bulging. Sometimes people have no discomfort associated with that type of presentation, but sometimes people will also experience pain in that area. And that can be kind of a sharp, acute pain if it develops all of a sudden. Sometimes people will describe more of a chronic achy pain that they may correlate with, I have a bulge, I have some discomfort. If I lie down, the bulging goes away, the pain goes away. So it's usually some of those types of presentations. Occasionally, people are seeing their primary care provider and they're doing a full exam and the primary care provider says, hey, I think you have a hernia, and the patient really didn't have any sensation of discomfort or didn't appreciate a bulging. If a patient comes to see us and we agree that there's a hernia there, the first question is how much it's bothering them. Sometimes people are sent with a hernia that they may not have known that was there, was picked up by their primary care provider, or they're not having any symptoms. And so then the question is there a reason to fix it? Some types of hernias, if there's intestine involved, even if they may not be having any discomfort, there's still the concern that it could turn into something more serious, so there's the recommendation to fix it. On the other hand, if somebody has, for example, a very small belly button hernia and it's not causing them any discomfort, there may be discussion in which it's reasonable to watch and wait and hold off on surgery unless it changes in some way or they start to experience discomfort. And so then if the decision is made that the patient and the surgeon agree to proceed with surgery, then the discussion is, so how do you fix it? Depending on the type of hernia and the size of the hernia, that affects what the options are for fixing it. Very small hernias, oftentimes at the belly button area, can sometimes just be repaired what we call primarily, or putting some permanent suture material in to seal up that hole. As the hole gets bigger, or in other areas, there oftentimes is then a discussion about putting in some mesh material. And that works to cover up the weak spot in a way that doesn't put tension back on the tissues of the abdominal wall. And so your body scars into that mesh material to cover up the weak spot so that nothing is bulging through the hernia area. Those options of putting in mesh, depending on where the hernia weak spot is located, sometimes those are done through what we call an open approach, so making an incision over the weak spot and approaching the repair that way. Sometimes we're able to do it in a minimally invasive fashion, laparoscopically or robotically, which involves smaller incisions to approach that area in a different avenue and then affecting the repair that way. I think it's important that patients, in the context of the discussion about a hernia repair with their surgeon, they need to understand where the hernia is, what kind of hernia we're talking about, why the surgeon would be offering them repair, what type of repair that the surgeon is offering them, and then what it means in terms of having that surgery performed, recovery, risk factors associated with the surgery. So some of those are discussion we have with every patient anytime a surgery is discussed, but things that may be kind of unique to hernia surgery would be a lot of times they will have increased limitations on their activities afterwards to try and let things heal up in an optimal fashion. Sometimes when we're talking with patients about a hernia repair, there are other issues of their health or lifestyle that impacts their success for a successful hernia repair in terms of, are they a cigarette smoker? How much weight are they carrying? How well controlled is their diabetes? And so those are all discussions that the surgeon and the patient should have beforehand to try and really optimize their chances for a successful repair. Because one thing I tell patients is your best chance at a durable repair is the first repair. And sometimes, unfortunately, you do everything right and the hernia still comes back, but it gets harder to fix each time you have to go back. So you really want to stack the deck in your favor the first time.